Okay, Julie, the webinar is now being recorded. Just let me know when we are good to start, and I will go ahead and start and take us out of the practice session.
I think we're good to go, and you can take us out, and then we'll just do like a little bit of a wait until there are attendees in the room as well. So you can go ahead and do that now.
All right, wonderful.
Hello, everyone, and thank you for joining. We're just giving it another few seconds to allow people to file into the virtual meeting room, and then we will get started. Okay, I think we will get started. Thank you all for joining. Excellencies, dear colleagues, thank you for joining this side event on how the care economy needs to change for a new social contract. My name is Julie Garfield Kofoed, and I'm the Senior Director for Sustainable Development Initiatives with the United Nations Foundation. We're thrilled to be co-hosting today's event with our close partner and ally, Southern Voice. I'm looking forward to hearing the perspectives of scholars and experts alike from the Global South on approaches, experiences, and new solutions in the discussions around rethinking care. As we move through our program, please be sure to follow the conversation on the Twitter account of Southern Voice as well, which is @SVoice2030. Please be advised that we're providing English-Spanish translation throughout this event. You simply turn it on by clicking the little globe in your bottom right-hand corner of your Zoom screen. And with that, I would now like to give the floor to Carolina Robino, Senior Program Specialist with the International Development Research Center. Carolina, over to you.
Thank you, Julie. Thank you to the UN Foundation and Southern Voice for the invitation to be part of this panel. It is such an honor to join this wonderful group of thinkers and doers that are really trying to transform the care economy. So I would like to take this opportunity to talk about the urgency of transforming the care economy and to share some ideas on how IDRC is investing in the care economy as an essential component of COVID-19 recovery and to building an inclusive and sustainable world. So let's take a moment and try to think on our societies without care services. Can you really imagine our societies and economies functioning without care work? The pandemic has exposed a care crisis. It has exposed the importance of unpaid care work as predominantly women everywhere left paid work to stay at home, to look at after children out of school or family members with illness. Or if they didn't have to stop working outside the home, they shuggled even further these things, increasing even more their time poverty. As you know, most of care work across the world is unpaid, and its distribution unfair. And we will hear from recent ILO data on this. So if this work was counted as part of the formal economy, it will constitute about 15% of the GDP in Latin America. So it is really a key part of the economy. The thing is, it remains unrecognized and uncounted. And for paid care workers, needless to say how unfair the pandemic has been, imposing a huge toll on them without recognition and poor remuneration. When we consider paid care work, about 90% of care workers are also women. And while the care sector is a big employer for women, working conditions are extremely precarious. The large majority of care workers do so in the informal sector, so you know, meaning no contract, no social security, and little, and even in some cases, no remuneration. So this is the care economy that we know today. The sector of the economy that is really responsible for the provision of care and household services that contribute to the nurturing and reproduction of current and future populations. And the pandemic has exposed, as I said, a crisis in the care economy, but this existed even before, and is a crisis that needs to be addressed urgently for the sustainability of life, people, and planet. So gender equality and inclusion and the care economy are central to IDRC's mandate and work. And let me quickly situate briefly IDRC in the wider world for those of you who may not know us very well. So the International Development Research Center, IDRC, is part of Canada's foreign affairs and development efforts, and our strategy is to engage and support research in the Global South for the Global South, to address critical knowledge and innovation gaps towards building a more sustainable and inclusive world. Southern Voice, a network of about 60 think tanks from Africa, Asia, Latin America, and co-organizers of the panel today, is a very nice example of IDRC partner and support to help address the knowledge production and practice asymmetries between the North and South. The policy brief presented today in this panel is the result of the gender working group in Southern Voice that IDRC is supporting. And at IDRC, we think these asymmetries between North and South not only inhibit the plurality and richness of approaches, but they prevent innovation based on first-hand localized knowledge. As the discussion today will demonstrate, it is not only urgent to act to transform the care economy, we think it's also imperative to do so with local actors in the driving seat, with locally generated knowledge. In the care economy space, working with our partners in the Global South, our program at IDRC ranges from understanding how care responsibilities hamper women economic empowerment to contributing new evidence for business and private sector innovation in the care economy, to innovative technologies that save women time and reduce carbon emissions. So we are also looking at the climate angle as well and the intersection between care and climate. The evidence we support shows how crucial is public investment in the care economy. It is urgent that the public sector invest in care, but public sector alone is not enough. The scale of the transformation needed requires also mobilizing the private sector. We need a new social contract for care in which the private sector is also a key part. As the policy brief notes, community-based care services and cooperatives have grown during the pandemic. However, these grassroots self-organized services remain undervalued. We need to support and strengthen cooperatives, SMEs, grassroots movements, and purpose-driven businesses in the care economy. And for this, IDRC and the Soros Economic Development Fund from the Open Societies Foundation recently launched a new action-oriented research initiative to help transform the care economy through impact investing. And you can learn more about this through the link in the chat that we are sharing now. So to conclude, we think evidence-based policy discussions and peer learning can accelerate a much needed change towards the 5 Rs for the recognition, the reduction, and the redistribution of care and domestic work, and for the remuneration and representation for care workers. We need to work together to advance and conceive care as a human right, both for those that need care and for those who care. And I am eager to learn more on how to do so in this panel. So thank you very much.
Thank you, Carolina, for your opening remarks and for reminding us of the sacrifices made by care workers during this pandemic and that we need to work together to advance and conceive care as a human right. Also, a big thank you and welcome to all of you for joining us today. Good morning, good afternoon, good evening, wherever you are in the world. My name is Patricia da Silva. I am the program advisor at the Initiative for People of African Descent at the United Nations Population Fund. I am thrilled to be here with you today to moderate this event, which, as mentioned, is being organized by both the United Nations Foundation and Southern Voices. Indeed, it is very important that a diversity of Southern voices are present and heard, not only on issues like this, but also in all discussions taking place on the global stage. And I am very excited and pleased that we are able to provide such perspectives for you here today. And let me now introduce our distinguished panelists. First, we will hear from Tatiana Rincon, the Vice President of Fundación Capital and part of Southern Voices Gender Latin America Working Group. Tatiana, bienvenida. Next, we welcome Madina Goloba, Senior Research Fellow at Economic Policy Research Center in Uganda. Madina, it's great to have you here with us today. Last and certainly not least, our third speaker is Maria Lourdes Sirinakes, specialist in the Office on Gender and Enterprises at the ILO. A very warm welcome to you too, Maria Lourdes. Finally, we will hear closing remarks delivered by Mrs. Mayra Sorto, Minister Counselor from the Permanent Mission of El Salvador to the United Nations in New York. Ms. Sorto, we look forward to hearing your insights. And now, without further ado, let me invite Ms. Tatiana Rincon, Vice President of Fundación Capital and part of Southern Voice Gender Latin America Working Group, to consider the following question. Tatiana, the policy brief puts emphasis on rethinking care in Latin America. What does this mean, and why is it necessary in the context of a new social contract? Tatiana, the floor is yours.
Good morning. It's an honor to be here. I would like to express my gratitude to Southern Voices for all this effort, as well as UN Foundation. It's an honor also as well to be with my fellow panelists, and also representing the women who put together the policy brief that we are sharing today. I should say the social contract has an implicit idea that women have to undertake care activities. And what we need to do is to have like a new social contract, and this is what we have been discussing, a new social contract where care is shared between citizens, the state, and also by the private sector, as Carolina was highlighting. We also need to foster trusting and collaborative relations. And care is everyone's business, is not only women's business. And when we are talking about rethinking care, we mean three things. First, we have to revalue care work, make it visible. That's why we are proposing a basic care basket, which means quantifying how much care costs. And also we have to measure and value the resources that families put together in order to produce quality care. And also we need to identify the work and the time families devote to such tasks. And why this is important? This is important because if we know how much care costs, we will know which households do not have sufficient resources. So as a state, as a society, we can allocate these resources for the well-being of these families. A second aspect is about strengthening community care systems. And I'm thinking a lot about what happened in Argentina. when the pandemic hit Argentina, many women from very poor neighborhoods and vulnerable neighborhoods, they opened their kitchens. And the workers of those kitchens, 90% of them were women, most of them were migrant women, and they did not receive any income for this community care work. So women were shouldering all the burdens of the pandemic, and we as a society, we didn't acknowledge this grassroots work. So in this new social contract that we are proposing, that we are suggesting, we need a universal social protection system in which public and private actors can contribute to care and can support these community care systems that I am sure Marina, I guess, is going to share about this in a few minutes. The same happened, I believe, in Africa. And last but not least, a third aspect of rethinking care is also about changing gender stereotypes. We need to incorporate men in care tasks. We even need an equal distribution of rights and responsibilities in this democratic ideal, and we need to change social mindset. We need care, we need to value care as a central value and not something that is under the rug.
Thank you, Tatiana, for your insights and for giving us a clear understanding of the urgency of rethinking care in Latin America. Care is indeed everyone's business. And also thank you for bringing up migrants. I did notice that you used an intersectional lens in this body of work. Can you tell us why it was important and what did it reveal?
Okay, intersectionality is very, very important because not all women are the same. And of course, we are affected accordingly to our social status, our age, our even like how big our families are. Of course, women that cannot afford paying for care work, they were more affected by the pandemic and in general by the crisis. And like these women, they need the most the community and the grassroots care services. So when we apply the intersectionality lens, we will know where to allocate resources, limited resources in general in terms of the public sector and the public economy. So of course, I mean, the pandemic brought bigger inequality gaps in Latin America. So there were women who have been more affected, who have been having more challenges even to reintroduce themselves for the economy. The gender pay gap has been bigger for women than men. And we have lost a lot of effort. We have lost even decades in terms of advancement of gender and gender rights and also as gender equality. So all of this, we have to consider who are the most vulnerable, especially like migrant women. This is something that has been affecting Latin America very strongly during the last 5 years. And also the indigenous communities who traditionally have been severely affected by poverty, and they have to burden as well the cost of care.
Thank you, Tatiana, for that. Indeed, who are the most vulnerable? We need to still continue to work on that. Next is my distinct pleasure to pass the virtual microphone to Ms. Madina Guloba, Senior Research Fellow at Economic Policy Research Center in Uganda. Madina, what did the distribution of care look like during the height of the pandemic in Uganda and maybe in sub-Saharan Africa at large? How did it compare to what happened in Latin America or other regions? Madina, the microphone is yours.
Thank you, Patricia, and good afternoon, good morning to everyone. I'm having a bit of a cold, but I'm hoping I'm audible, and it's inevitable. Basically, this is interesting, and thanks for the invitation. The COVID-19 actually, to me, glared out issues that are already in place in terms of divisions between the social norms and the gender roles. So it just heightened or exposed already what is already there on ground. And if any of our governments are smarter and to actually cut this forward, would have used this arena of COVID-19, exposing what is happening within the care world to this effect. That's what COVID actually did. And you see in Uganda, some of these issues, like, should I say that already the economy, care economy, both the paid and unpaid, we had these divisions of the informal sector, the formal sector aspects that are coming in. And already the divisions were there. So you see an economy with women being the largest workers, but with labor force participation so low. And that's making it worse. Even the employment population ratio for women goes further down when you bring in employment aspects. So already these shape you to see where you're heading. So when COVID-19 struck, it brought up these kind of divisions. In terms of the time use survey that we're having now, we are happy that some of the information that was collected picked both information post-COVID, pre-COVID. So when we look at the gender aspects in there, it's really interesting that while women within a week, let me say 24-hour day, they spent pre-COVID 22 hours on unpaid care. I'm giving an example. After COVID, these hours increased by 6 more hours. If you look at it, 6 more hours increased after COVID came in place in terms of lockdowns. Compared to men, it was 14 hours in a week, but it came to 16 hours, just 2 hours more. So you can see what COVID-19 did. 10 hours more burden, in case you look at the total for women in this case. So COVID really did heighten this, at least in Uganda. And what was interesting for, and what I see even in Latin America from the brief, is that the burden increasing on the women, not only women who are in informal employment, but what was interesting here is informal sector women continued working. That's the interesting bit of it. But they worked under precarious conditions, such that you'd leave your children home to the community to look after, while you're sleeping in the markets looking for the daily income. And while for the women who are in paid employment, you are sitting at home on your Zooms with your husband, probably looking after the children as a leeway. But necessarily when the ECD centers close, those are the early child development centers closed. That means all this burden went to the women in terms of keeping the children engaged. The housemaids incidentally actually also left our household help. When they left off up country because of the height of the pandemic, then all these issues within their home really end up relying on the women, which heightened issues around domestic violence. So, and this was an interesting thing when I read also the brief, it pointed out some of these issues. And the comparability here, what I saw was level of development does matter, Patricia. It really does matter. Why? Because whereas we are all poor in developing countries as being termed, you find that the social community cohesion within these communities in Latin America were more stronger than in the Ugandan economy, in terms of where at least government would come in to make sure the cohesion is well built. Whereas within the economies, the cohesion was left to the communities to do as they please, in terms of what they felt was actually important to support the social systems. So I actually do buy what Tatiana was saying, that we need to really strengthen social community networks going forward in terms of reducing unpaid care. So for sure, we need to see a little bit of things changing. Technology, I saw technology working better for Peru, but here, because we still do the rudimentary ways of doing things, you wash clothes by hand, you have to use firewood to cook. And now everything is at the height of prices very high, markets are closed. So in a point of destitution of going out to look for this simple firewood to cook. So those are the differences I saw, at least within these two economies, within Latin America and Ugandan economy. But you can see it really worsened the care world and brought to light the discrepancies that really the vulnerabilities are actually ingrained. That the men still will sit, and in case you have older children, they'll be taking over the responsibilities of their fathers to support their mom in doing activities within the house. I submit.
Thank you, Medina, for that. Such important points you just made here. The importance of technology, social norms, the importance of us continue to work on social norms. COVID that exposed really issues that were already there, and of course the importance of community. Thank you for helping us understand the challenges women really will continue to face if we do not take quick action. Now we will hear from Maria Lourdes Sirinakis, specialist in the Office on Gender and Enterprise at the ILO. Lourdes, an important dimension of the policy brief we're discussing here today is the focus on care work as a service, like Medina just pointed out. Given the broad range of unpaid activities that became visible during the COVID-19 crisis, it is clear that we're talking about an under-recognized service sector. So to what extent would you say this frame is already present in the current thinking of the ILO?
Thank you so much, Patricia, for your question, and thank you for inviting me to this panel. I would like to start by saying that care services are a key component of the transformative care policy packages that the ILO is calling for in its new global report on care work, which was launched on May 8th. Mainly, the ILO proposes a continuum of care policies and services that range from maternity and paternity leave and breastfeeding entitlements to childcare and long-term care services for all workers with family responsibilities. These care policy packages should be country-specific and include a combination of time, that is the leave, benefits, income security, rights and services to enable the right to care and to be cared for, and promote gender equality and decent work. Before I go into the report, I would just like to point out ILO's definition of care work, which includes face-to-face personal care activities like feeding a baby, and indirect care activities that do not entail this face-to-face personal care like cooking or cleaning. Care work always takes place within a relationship between the caregiver and the care receiver and can be paid or unpaid. Now, the ILO differentiates between the unpaid carers and the paid care workers. Unpaid carers are those who care for people and undertake housework without any monetary compensation. And as we already know and has been mentioned by my fellow speakers today, the majority of the unpaid care work takes place within the households and is most often provided by women and girls, with the negative consequences on their own economic opportunities and well-being, as well as of those of care recipients. Their contribution has been recognized as work since 2013 in the International Labor Statistics. On the other hand, we have the paid care workers, which include a wide range of workers who differ in terms of education, skills, sectors, and pay. We have university professors to doctors to childcare workers and domestic workers, direct or indirect care work in the health and education fields, as well as in other sectors. And the ILO works with the 5R framework for decent work care, which benefits both the unpaid and the paid care workers, as it advocates to recognize, reduce, and redistribute unpaid care work, reward paid care work by promoting more and decent work for care workers, and guarantee care workers representation, social dialogue, and collective bargaining. In this region, and this is where I'm going to finish my intervention for this question, ILO focuses on promoting decent work for care workers, in particular domestic workers, which, as has been mentioned before by the other speakers, are in general informal workers. Back to you, Patricia.
Thank you, Lourdes. I have a follow-up question for you. Could you share some insights on ILO's current priorities areas for action, particularly taking consideration the transformative care policy packages? Are they different depending on regions? If you could just help us and clarify that.
Yeah, thank you. I would like to go into this report to explain this different care package. The report surveys care policies, in particular maternity protection, paternity and parental leave policies, and policies related to the health and protection of pregnant and breastfeeding women, as well as childcare and long-term care services. In total, it surveyed 185 countries to create this report. And these are some of the main findings, right? There has been some progress, but there's still a long way to go. For example, there's still 649 million women that have inadequate maternity protection or no protection at all, because in 82 countries, maternity leave is shorter than the 14 weeks established by the ILO Convention 183, or is paid below the 2/3 of previous earning, or is paid solely by the employers instead of the social protection. At this pace, it means that it will take 46 more years to achieve the minimum maternity leave rights in these 185 countries analyzed. Why is this policy important? And of course, it offers a lot of benefits to women. You know, it is essential to guarantee the health of the mothers and of the newborn children. And maternity protection also allows mother time to recover from pregnancy and also time to adjust to a new life. When we look at the paternity leave, and this was mentioned before also by the previous speakers, there is a very long way to go. Like 1.26 billion men who live in the countries that were surveyed have no entitlement to paternity leave. And when there is paternity leave, it is much shorter than maternity leave, with a global average of 9 days. And usually is many of the men don't even take it because if you know it's not paid well, or because of the gender norms or the design of the policy. So it is very important to include men also in the care and changes gender norms, as was mentioned before, because this can be one of the transformative policies, you know, changes this mindset and redistributing unpaid care work that has always been on the shoulders of women, as has been mentioned. And if I just want to mention additionally the care services, you know, this really yield plenty of benefits. Of course, they promote child development, they create jobs, they reduce parents, which we know it's mainly women's unpaid care work, and promotes women employment and income over the life course. Unfortunately, in the 185 countries that were analyzed, these childcare services are available for only 1 out of the 10 potential parents across the world. And the report mentioned that there's this global childcare policy gap, which refers to the time when the license ends and the time when school starts, primary school. It's like a gap of 4 to 5 years, and parents, and we know in particular women, then have to deal with this like childcare gap, right? Which then makes the fact that some of the women leave the labor force, or they take informal work, as has been mentioned, or they take part-time work. So it's very important to have this like transformative care services and also policies that can change the world of work, including these care services. I think I'm going to end here because I took more of my time. But just before I get back to you, Patricia, this is very important. It was one last thing, because a study by the ILO and UN Women just revealed that 2 million moms left the workforce only in 2020 because of this, you know, pressure of juggling work and family. Also because most of the work's jobs were lost in female-dominated sectors. But we're talking about very important care packages that can really stimulate women's permanence in the workforce. Back to you.
Thank you, Lourdes. Progress, but still a long way to go. Collectively, we really need to continue to accelerate our efforts towards gender equality. Lourdes, thanks for sharing this important information and for clarifying for us ILO's frame in the context of the care economy. Well, we shall now move to our second round of questions from our panelists. And I will start with Tatiana and Medina. Tatiana and Medina, in light of your respective research, the recommendations shared here today, and the areas outlined just now by Maria Lourdes, where do you think ILO's care economy agenda best intersects with the priorities you have seen emerge here today? Tatiana, why don't you start?
Thank you. I really believe there is a very strong correlation between both reports, ILOs and the policy brief. I think that we are totally aligned in terms of the 5 Rs and the necessity of recognize, reduce, redistribute, reward, and represent, all about care. Also, what I really like about the report that Maria Lourdes just explained is about like how these recommendations should be custom made according to each country and each need. When you were just speaking, I was thinking about like, even though maternity and paternity leaves are very, very important, like most of our economy is informal, so even people don't have the right of getting a maternity or a paternity leave, because at least 70% of our economies in Latin America are informal, and almost 70% of those workers in the formal sector are women. So I really like, and to me resonates the idea that this is something that is custom made by each country, even though the challenges we face are universal. And I really love the idea of these care policy packages that are fitted to each one's context. And I believe this is something that it's that can be related with intersectionality, because it's not only about thinking about the difference between countries, but even within our countries, how we can even reach the most poor and the most vulnerable women.
Thank you, Tatiana. Madina, would you like to add?
Yeah, thank you, Patricia, and thank you to Maria and the team. For sure, I do concur with what Tatiana said in terms of it. We need to recognize the heterogeneities within these economies, the differences that come in. As Adalia actually stressed, you see, most of the care work, both paid and unpaid, is shaped by the sticky gender roles, and which are emphasized by the social norms that exist in our economies. You see, Uganda has over 100 tribes with different social norms. So the level of acceptability even of the care packages that are being proposed are not going to be uniform within these economies because of the level of acceptability, globalization, exposure, and urbanization rates within our economies. So even if you look at the city centers, the social packages you're proposing can be more accommodative for the urbanites than the rural persons, where it's basically the stickiness of the negative norms are really ingrained and the intermarriages are fewer. So that in mind is very critical. And then probably also, as you talked about the paternity leave, it went in my mind, said, oh yeah, people here do get paternity leave for those in the formal sector. But let me tell you, even the 3 days they are given, the men, they don't look after these babies. They go and look out for business or not report to work. So the issue is, where's the value for this paternity leave as well? Who's going to be holding them accountable? That for sure the paternity leave is value for the child who's they are being given. So most of the time, we look at these social programs as, for at least for our fellow gender, in case they're not really sensitized, as a leeway to look for other businesses out there for the days they're being given their leave. So for sure that aspect of differences is really critical. And also to probably add is that, you see, one of the issues within our governments is the level of appreciation for this unpaid care. Mm-hmm. Even within this height of the pandemic, government will still tell you it's not a priority. And they'll tell you what is a priority within a priority. Madina, if we provide for you good healthcare services, and isn't that good enough for you right now? As you can see, we are handling this. And so how do you best expect us to do all these little nitty-gritties of infrastructure or education for ECD centers, public ECD centers? Like I've been seeing for the other, like Peru has a public ECD center. Uganda does not have that. It's highly private. So, and the level of affordability is going to be different. So the level of appreciation, even that bit we said recognizing, and the recognizing is not only for us within the homes. The recognizing has to be made above, and that has to be state level recognition and use of the cultural institutions we have, because culture is important. To change people, you have to change the cultural leaders. So the culture leaders are the ones who actually shape most of these people in terms of communication, media, announcements, and in terms of their level of involvement, that this is not going to reduce you as a man or make you less of you as a woman if you really do not do it, or in case you do share it out. So prioritizing government to come in to appreciate it, and the use of the local institutions, the leaders in terms of the cultural institutions to shape. I think it's very important for at the grassroots level, because it's very hard to change the grown-ups, but it's easier to change the young ones that are coming up to change right now. So that's what I'm thinking in terms of emphasizing what the paid and unpaid care components that go out there. Because you see, Medina, I work, I can pay maid, but the norms home would tell me, my mother-in-law said, you're not a woman enough to leave the maid to be looking after your husband. You should still be coming home early. So those are the kind of things we are thinking about. And in case they're not appreciated from the children we bring up, then interventions upstream or low stream are not going to help much, even the care packages that you're thinking about. So state intervention, state awareness, and the use of the institutions that actually affect our persons are the roots that we need to think through. Even if the budgets are put, they might not make change much until appreciation is done. Thank you, Patricia.
Thank you both. Tatiana and Medina are very important. The involvement of leadership and the state, taking consideration inequalities within and between countries, and of course the need to contextualize the recommendations for specific needs so that they are custom made. Just a quick follow-up question. Do you see any areas where your research is particularly at odds with the vision from ILO? Medina and Tatiana, any one of you? Maybe Medina?
Thank you. Not necessarily, but because right now we have a grant from the IDRC to do from promises to action. When I want government to act in terms of how do we change perceptions around care work and social norms for better care work. And we're using, you're looking at the cutting edge methodologies now, an RCT, which has never been done in social norms. So we're doing a randomized control trial where we want to see if community engagement or use of role model men, this is what they call the SASA model probably, and then working through empowering women through their BSLA, those saving group systems, combining these two to see with community leaders of cultural institutions if they're going to actually help us shape social norms. So it's a 5-year kind of work because it's a randomized control trial. But again, at the end of the day, we are seeing community engagement and communication is critical. Media kind of coverage involving the stakeholders from the beginning to have buy-in. Then the community persons being the leaders of change rather than coming from top bottom, from government to down. So we are seeing that kind of things happening going forward. And we'll be happy to share this as they come along to either affirm what Maria has actually talked about in terms, or to differ on how best we can best do approach and paid care activities in terms of which packages to offer best. I submit.
Thank you for that, Medina. Yes, meaningful participation from the community from the inception of these programs. So my next question is to Maria Lourdes. Partnerships between local actors and the state are crucial for a better and fairer redistribution of care. Well, however, across the global south, we know that many states face constraints, such as limited fiscal space. This is often where international partners like yourselves, the ILO, come in. Can you tell us a little about the work ILO does in the global south to support governments in the provision of care services?
Thank you, Priscilla, my pleasure. I'm gonna list some of the activities we have. Like, for example, in the year 2020, ILO launched a guide to occupational safety and health guidance on COVID-19 for employers and domestic workers in Mexico. In Argentina, we are collaborating in a project funded by the COVID-19 Impact Recovery Fund titled Promoting the Economic Autonomy of Women and the Care of the Elderly and Disabled in Argentina. In Peru, a project named Opening Doors, More and Better Decent Work for Domestic Workers is being launched with a special focus on representativeness, rights, and certifications of care skills. In the Dominican Republic, a joint project is being carried out with UN Women, UNDP, and UNFPA in care, in which the ILO develops the curricular part of the training of care of dependent peoples. In Costa Rica, an occupational profile of domestic workers has been developed together with the Ministry of Labor. And in Colombia, support is provided for care platforms and care workers. And from the regional office, efforts continue to identify bottlenecks in social protection, care, and gender, with particular attention to domestic workers. We try to improve and increase the effectiveness of institutions related to social policies and social protection systems by proposing elements that allow for the integration of intersectional gender perspectives in the design, implementation, and evaluation of public policies. We also launched in November 2021 the first report named 10 years after the Convention 189, Progress, Limits, and Challenges. And we also held regional workshops with the International Federation of Domestic Workers to know their current concerns and draw a roadmap for Latin America and the Caribbean. And finally, I'd like to say that within the activities to promote the Convention 190 on violence and harassment in the world of work, numerous activities are continued being carried out with feminist organizations in the regions, and also with trade unions, organizations, and organization of women domestic workers, as they're also particularly vulnerable to exploitation in their work. So that's like an example of the things we do. And I just wanted to add to what was mentioned before. This new report, the report on care at work, also emphasizes from an intersectional gender perspective that there are specific workers that are in more vulnerable conditions, like was mentioned by Carolina, and like the informal workers or the independent workers, those who don't have access to this like policies, like for example, maternity or paternity leave, because they're outside the formal work. So it does emphasizes that we need to focus on them to provide them, the different care services and access to this care policy package. Back to you.
Thank you for that, Maria Lourdes. We actually have a question that came from our audience as a follow-up, and you also mentioned disabilities. So the question is there special consideration given to care work packages for children with disabilities, given they have extended special needs more than any other group? Can you address that?
Yeah, sure. Thank you, Patricia. I didn't specify what the report calls the long-term care services, which would involve two things. One is care of the elderly, right? The dependent elder people. And the other one is the care of people with different abled bodies or people with disabilities. And this, for example, in Dominican Republic is is a line of work that is being newly developed. Infotep, which is the National Vocational Training Institute in Dominican Republic, asked the ILO to help define this program to train trainers on the provision of care for people with different abilities. So it's one of the specific lines of work which is included in this like care package that, like I said, it not only includes policies, but also care services, which are care for children, care for elders, because they have the right to age, right, in dignity, and care for people who require continual care throughout their lifetime. Also care for them to have they have the right to have an independent life, and it is also considered. Mm-hmm.
Great.
Back to you.
Sure. Thank you so much for that, Tatiana. Sorry, Lourdes. Tatiana, I'm moving to you now. So going off back of Lourdes' remarks, where do you see the best opportunities for multilateral partners like the ILO and other UN agencies to support local, state, and non-state actors in implementing the recommendations from your research?
Yeah, no, I definitely believe that ILO and the UN agencies have done a fantastic work in terms of influencing governments so we can continue promoting this agenda internally. I really like what Marina mentioned about how we can engage leaders. And I believe that multilateral organizations can influence leaders in order to take action on new, in terms of social norms transformation. Also, the basic care basket agenda, which is something that is very important for the, not only for the policy brief, but is really important if we can measure, if we can really, if we know if we are doing any progress or not. That's a way of valuing care work and putting the top of the mind of the society, starting from the leaders. That the importance of doing all this work and really paying attention into this, because this is not a secondary topic in the policy agenda. So it's the ILO and the UN agencies can play a really important role on that. Also, another important aspect is to work more closely with local actors and to acknowledge grassroots actions and solutions, because many, I mean, sometimes like the best answers that I have found in my work is when I take the time to care, to listen, and to see what are the ideas of how people at the grassroots levels are coping. So if we can really see these efforts, put them, highlight them, build bottom-up policies. This is really fundamental for our work, because I believe that we are all of us, we are in the same direction. And also something that I would love to see, and is something that I believe that we can work together, is an agenda based on practical needs of the communities. So this is at least two ways where I can see we can continue working together.
Thank you for that, Tatiana. Medina, is there anything you'd like to add to these suggestions?
Probably one which I will emphasize, given I come from research, is probably for our leaders to pay more attention to evidence use in implementation, which is often lacking in politicizing everything they do. And so the need for good data and good evidence to inform decision-making, because this research is evidence-based. So if they are telling you how many should we do this for, we do not see why government should not listen to this piece of evidence. And also put into the agendas a learning agenda, which is often missing. We learn by doing. You fail, learn again and improve. You don't need new issues to do again. So most of the time we see our programs failing because government introduces a new program as if it has never been done elsewhere. So the learning agenda in some of the suggestions needs to be emphasized, that please, if we have the refugees or the young children and the program we put in place has failed or needs to be improved, we can build on that and fill them the gaps. So the need for data and the need for learning needs to be emphasized in most of these suggestions, and the need for governments to make sure they use our evidence-based planning.
Mm-hmm. Yes, could not agree more. Take action for transformation, to transform social norms, valuing care work, bottom-up policies, the importance of building evidence and data. Thank you so much for that. We have one more question from our audience. Let me just find it here. Are we able to quantify unpaid care work, and how does this information feature in local policies? Tatiana, do you want to take that?
Yeah, this is something that that needs to be done and built. I know that in some countries there are different forms of measuring that, but the issue is that we need something comparable. And as we have been able to progress in terms of indicators, gender indicators, we have seen the difficulties of measurement. So even though there are like several attempts, we need to see, we need to really think deeply in terms of how we can we can measure the time, the work that is put. Carolina just mentioned at the very beginning, for example, that care is accounted for more or less 50% of the GDP. But since there are no consistent way of measuring this country for country, this is an approximation. So I believe that we really need to think about how we can try to encompass like a global measure of care and to continue doing the research. We know this is something of value, but this is something that I see that we have a lot of, it is very important to advance in terms of this component of care, because I have seen statistics and information, but it is very country specific. So in that way, we cannot even compare. All what we have up to this point is our approximations. And this is a fundamental point, I believe, for future research and collective engagement.
Great. So we are reaching the end of our event. So I'll ask our panelists to give us a 60-second wrap up, call to action, if you will. And Maria Lourdes, I will start with you. 60 seconds.
Thank you, Patricia. I want to end by saying that our report, the Global Care Report, says that if we invest in care policies and services, we could generate up to 300 million jobs by 2035. These jobs will actually be driven by 96 million jobs, direct jobs in childcare services, 136 million jobs in long-term care services, 67 million jobs in the non-care sector. And women would occupy the majority of these jobs, promoting thus the access to decent jobs for women and the promotion for gender equality. And my last sentence is there will be no human-centered recovery, nor a more gender equal world of work without care at work, as has been established in this report. Thank you.
Thank you, Maria Lourdes. Tatiana?
I would say that we should continue advocating about the value and care, and that care becomes a central value, and it is something, and it is not something secondary, something that we hid under the rug, but we have to put care as the central of the even of the economic recovery and the general well-being.
Thank you, Tatiana. Madina, your turn.
Thank you. I think the call to action I'll do here is probably we need to ensure that as government comes in, now issues jobs, as Maria said, how do we shape social protection issues and unpaid care work in our bid to say this is going to create jobs? I think government will listen more. In terms, if we say we put more ECD centers, it's going to be more jobs for people. Hospices for old persons, jobs are going to be created. And this is private sector led, but we need government support systems in terms of environment to be supportive to this. So I think that is a critical issue. How do you pitch it for them to take it on, especially policymakers in this pandemic world? Jobs, jobs, jobs. How? Let's improve social protection systems. And then how will the jobs be created? There'll be spillovers, disemployment and decent work for both men, women, and the youth in particular that we are looking out for. And lastly, we need to leverage on the technology that's coming up to make sure unpaid care work eases for everyone. I submit.
Thank you, Madina. I will thank our panelists for their inspiring words, our participants for their thoughtful questions, and will now pass the microphone to Mrs. Soto, Minister Counselor at the Permanent Mission of El Salvador to the United Nations in New York, to share some final remarks. The floor is yours.
Muchas gracias, Patricia. Buenos días a todos los que nos acompañan en este evento. En primer lugar, deseo expresar el más sincero agradecimiento de El Salvador a Southern Voice en United Nations Foundation por organizar este oportuno evento y a los panelistas por sus excelentes presentaciones. Sin duda alguna, los impactos de la pandemia del COVID-19 no han sido neutrales frente al género y su impacto ha profundizado en muchos casos desigualdades preexistentes. Considerando estas evidencias, desde la Comisión Económica para América Latina y el Caribe, se ha impulsado la importancia de adoptar sistemas integrales de cuidados, como un conjunto de políticas encaminadas a concretar una nueva organización social de los cuidados con la finalidad de cuidar, asistir y apoyar a las personas que lo requieren, así como reconocer, reducir y redistribuir el trabajo de cuidados desde una perspectiva de derechos humanos, de género, interseccional e intercultural. Asimismo, me gustaría señalar que el informe de la CEPAL titulado La economía económica de las mujeres en una recuperación sostenible con igualdad establece además la importancia de la implementación de políticas fiscales que contribuyan simultáneamente a los objetivos de recuperación económica y el cierre de brechas de género e invertir en la economía de cuidado y llamar la atención sobre sus efectos multiplicadores en términos de participación de las mujeres en el mercado laboral, bienestar de la población, redistribución de ingresos y tiempo, crecimiento económico y mayores ingresos fiscales. En ese sentido, dar prioridad al tema de cuidados y colocarlo en el centro de la agenda social, económica y política es indispensable para el logro de la igualdad. Aprovecho este espacio para destacar que en nuestro país se han desarrollado diversas iniciativas sobre el tema de cuidado con un enfoque de género, como el fortalecimiento del marco normativo para la igualdad, a fin de regular las relaciones entre las parejas y sus hijos, estableciendo derechos y deberes recíprocos sobre bases equitativas. Asimismo, contamos con un Plan Nacional de Igualdad 2021-2025 que comprende compromisos y lineamientos de políticas públicas y estratégicas en el tema de igualdad, teniendo como uno de sus ejes prioritarios la autonomía económica, cuidado y protección social para las mujeres. Además, El Salvador impulsa diversos esfuerzos de trabajo interinstitucional, promoviendo la idea de la corresponsabilidad de toda la sociedad para la construcción de la igualdad y de una vida libre de violencia para las mujeres, reafirmando así su compromiso de promover la igualdad de género y el empoderamiento de todas las mujeres y niñas como condiciones necesarias para lograr el pleno ejercicio y disfrute de sus derechos. Finalmente, y como ya se ha mencionado en este evento, el COVID-19 ha sido un punto de inflexión para la humanidad y nuestra recuperación debe apuntar a construir un mundo mejor para todos, desarrollando e implementando enfoques sensibles al género en los esfuerzos de respuesta y recuperación, abordando acciones relacionadas con la inclusión financiera de las mujeres, la igualdad de remuneración por trabajo de igual valor y oportunidades profesionales, así como el liderazgo de las mujeres y garantizar su plena participación en la economía, asegurando que ninguna mujer se quede atrás. Muchísimas gracias por invitarnos a participar en este evento.
Muchas gracias. Thank you, Mrs. Soto, for your important remarks. Dear participants, panelists, we have reached the conclusion of this event. My sincere thanks to the UN Foundation, Southern Voice, and the International Research Development Center for convening this timely side event. My thanks also to you, the panelists, and the mission of El Salvador, and a warm thank you to our audience. We invite you to access Southern Voice's recent published research on their website, as well as right here on the chat box, as well as other relevant resources available to you. We hope you enjoyed this discussion. Muito obrigada, and goodbye now.